Welcome everyone to the latest webinar with Cosmetic Laser Dermatology. We are very excited today to be here with our two esteemed speakers. First of all, we have our board certified dermatologist, Dr. Jameson Loyal. Dr. Loyal joined our practice a little over a year ago, but also did his fellowship with us. So he has been trained and spent a lot of time working with all of our physicians. He is an expert on all things cosmetic dermatology. So he is going to be great for any questions you might have on Botox or fillers, injectables, any of our laser treatments, laser resurfacing, any of our body sculpting treatments, or really just any of the aesthetic treatments we offer at Cosmetic Laser Dermatology. With him today, we are very excited to have our one and only medical esthetician, Farzaneh, who has been with us over almost 20 years now, maybe over 20 years. And if you've met her, you know why, because she's amazing. We are very excited to have both of them here today, so you guys can hear both perspectives from the board certified dermatologist and the medical esthetician, and hopefully get a sense for how we really try and integrate them together to provide you all, our patients, with the best possible results. So this webinar is being recorded, so if you miss anything, we will send out the recording and you can forward it to any family or friends. And otherwise, let's get started. So thank you, Dr. Loyal and Farzaneh, for joining us today.
Of course.
All right, let's get into it. So this is a great one to start off with. All right, so I'm interested in several procedures: Botox, fillers, lasers. Is there a particular order in which the procedures should be done?
So my stance on order of procedures is answered usually during the consultation to seek what the patient's main goal is. And most of the time, those different procedures can be done in one single session, depending on what we're treating. So fillers, lasers, and Botox typically can be done on the same day, depending on where we're treating and what type of laser we're choosing. And I always bring it back to what I consider the main pillars to adequately rejuvenate a certain area. And those pillars, in my opinion, are skin quality, which includes evening out pigmentation, both brown pigmentation and red pigmentation. Skin quality in terms of fine lines and wrinkles. So pigmentation could be addressed with lasers. Fine lines and wrinkles can be addressed with neuromodulators such as Botox. Sculpting and facial balancing with dermal fillers. So all of these different pillars are taken into consideration. And one of my go-to combination treatments is doing 4 different treatments on a single day. So I use typically intense pulse light, or IPL, and that's going to treat sun damage, so brown pigmentation, red pigmentation. I then will typically do dermal fillers to sculpt the face, contour the face, add balance to the face. Then we would do a light laser that boosts the results of the IPL as well as to build collagen. We always want to be thinking about collagen banking and collagen stimulation. So I do a light laser for that. And then we end the treatment with our neuromodulator or Botox. Now we even have a newer treatment called Skin Vive, which is a skin booster. So in addition to all the pillars that I just mentioned, I think another really important pillar in rejuvenation is adequate hydration of the skin. And I've been using Skin Vive as the final step to hydrate.
Great, thank you. That was very comprehensive, and it's great to hear about your philosophy with those pillars. So someone else had a similar question that maybe could be a follow-up. If you do separate them with treatments, is there a recommended time between, like say you're doing a really aggressive laser, how long between some of these treatments?
So it depends on what type of laser, but the skin should rest and heal in between. So depending on the type of laser, I would say anywhere between 4 and 6 weeks, then we would address the next step in the rejuvenation plan.
Okay, beautiful. So here's one more question. I think this is another one for Dr. Loyal, and then we'll get to one for Fars. So I was born and raised in California, spending a life in the sun. I still walk outside daily and swim in an outdoor pool. I started getting Dysport and Botox at last year when I was 52 years old. I also had my first Clear and Brilliant treatment scheduled next month. Do I need to keep my expectations low regarding my skin because of how late I'm starting to get treatment? What can I reasonably hope for starting at this age?
So I feel like a lot of patients come in at that exact age. So I don't think that there's any age that is too late to start a rejuvenation plan. I do tell my patients that depending on when you're starting these procedures, you might need to do more procedures or combine different procedures to meet different goals, different pillars in the rejuvenation process, also to meet one's expectation. So everyone's expectations are different. So we want to curate a plan that suits everyone's individual needs. But I would say that many patients come in for the first time around that age, and life, at 50, in their 50s, is very young. You could have a whole nother life so ahead of you. So this is an appropriate age to start. Of course, we have patients that start a much younger, but there's no age that's too late, and it's a journey. And this is one of the things I impress upon my patients, that all of this is a journey and life's a journey, and this is part of one's wellness continuum. So you eat well, you exercise, you get restorative rest, and these anti-aging or rejuvenation procedures is just another pillar within one's wellness paradigm. So never too late.
Love that. All right. Farzaneh, I think this one's for you. What would you recommend to help get rid of blackheads? Is there a treatment? And is there any skincare you recommend for someone that gets blackheads?
Sure. First of all, hello everyone, and thank you for taking time out and being here for our today's webinar. And Lisa, thank you so much for all your help, support, and introducing us like beautifully. As everybody knows, in our office, Cosmetic Laser Dermatology, we offer a wide variety of customized aesthetic services. What I do, my work is I'm doing most medical skincare therapies and working very close to with the doctors. For the blackhead, your question is for the blackhead. Why do we get the blackhead? Most of the time we have a dead cells. Usually the dead cells, they clog the pores, they become whitehead, blackhead, large pores, dull skin, and aging skin. The first things we can do for our skin is to do a good exfoliation to remove all the dead cells. And then what I can do extraction, I can do a good exfoliation with many different devices I have in the office, like salt treatment, microdermabrasion. It's a lot, peels, many different kind of peels. We can do that one. How do you, if your question is about what products you can use to get rid of that one, definitely I do a good exfoliation, a good cleanser with alpha hydro acid cleanser to be able to remove the dead cells. You can use salicylic acid 2% every night. It depends on if you break out, if you have a lot of foam under the skin, or it's just a blackhead. I highly recommend that a good exfoliation and extraction.
All right, great. All right. Next up here, Dr. Loyal, is there a non-ablative treatment that helps eliminate wrinkles and tighten skin other than fillers?
So in terms of a non-ablative laser, what is a non-ablative laser? So A non-ablative laser is a laser device that is not breaking the skin. Unlike an ablative laser, such as a CO2 laser, that's basically removing the top layer of skin. What are the benefits of a non-ablative laser? So the benefits are the top layer of skin is remaining intact, so you're going to heal more quickly. In terms of improving fine lines, wrinkles, without dermal fillers, non-ablative lasers can help improve that. One of my go-to lasers for that is the Fraxel Restore 1550 nanometer laser. And with a few treatment sessions, you could definitely have improvement in fine lines, wrinkles. We could even use this off the face. So I tend to use this face, neck, chest. I even use it on the arms for crepiness and to rejuvenate the arms, even on the abdomen as well, stretch marks and whatnot. So great technology, minimal downtime.
All right. This is an interesting question. What procedure can help with crepey skin on my arms?
So a variety. So I usually use a multimodal approach, combining different procedures either on the same day or alternating in a series. And my go-to treatments for improvement of crepey skin on the arms, one is an injectable called Sculptra. Sculptra is a biostimulator. So it's going to stimulate your body's own natural skin cells to build collagen that's going to thicken the skin and rejuvenate the skin so there's less crepiness. That's one. Two, the Fraxel Restore, which I just mentioned, can be beneficial for crepey skin on the arms. And then three, a variety of energy-based devices. And that could include Ultherapy, which uses ultrasound-based technology, or a newer device called SoftWave, also ultrasound-based, and that's going to, again, build collagen to tighten the skin, to make the skin less crepey. And then finally, radiofrequency-based devices, such as radiofrequency microneedling, such as our newer device called Potenza, again, is going to build collagen to make your skin firmer, tighter, and less crepey.
Thank you, Dr. Loyal. All right, for Farzaneh, what is the advantage of the jet peel compared to PRP?
Totally different treatment. The PRP, usually we are using, Dr. Loyal can go through that one with you. Usually we use the macroneedling, and we infuse like the growth factor of your body to the scalp or to the body or to the face. What I do with the jet peel, with the pressure of the air and oxygen, without anything touch the body, I send the main ingredient, the serums they make it for. We have many different kinds of serum for firmness, tightness, for hydration, for pigment, for any different kind of skin tissue. I send the products with the jet peel deep to the skin. The macroneedling PRP is based off the needles goes to the skin. The jet peel is based off nothing touch the skin. Just the pressure of the air and oxygen. I send the products 3 millimeters deep to the skin. And Dr. Loyal, if you can talk about the PRP.
So PRP, or platelet-rich plasma, is the portion of one's blood where growth factors are in highest concentration. So we take your blood, we prepare it and spin it down, and then we'll use the growth factor portion of the blood to basically boost your own body's regenerative abilities, such as the scalp, where we could incite new hair growth. Additionally, we use it during radiofrequency microneedling, again, to further the healing process. So it could be an add-on, such as for radiofrequency microneedling, or a standalone, such as I use it all day, every day for the stimulation of hair and hair loss or hair thinning.
Just so you guys know, as you're entering in your questions and answers, and you can see what other people are entering, you can kind of vote on those to help us address the ones that you all are interested in the most. So here's an interesting question that maybe both of you can touch on. Are any of these procedures okay for people with sensitive skin? So let's see who wants to go take that first. Dr. Loyal?
So we always take one's skin type into consideration, again, highlighting the importance of the consultation. So if you do have sensitive skin or a particular skin condition, we want to hear about it during the consultation. And we could, again, curate your treatment to your concern and your history of your skin condition. So for individuals with sensitive skin, I would say above and beyond any procedure I do, an individual with sensitive skin can have done. What I want to highlight is the aftercare. So what I do in the office is extraordinarily important, and what you do at home is extraordinarily important. We're going to set you up for success, but recommended products for post-procedure care is extraordinarily important. So different serums, different creams might be recommended that would be best for your skin type, so that when you're healing, you're going to have a seamless healing process that's going to be quick without any reaction. So what we do in the office is just as important as what you do at home.
All right, and Farzaneh, what do you think for people with sensitive skin?
Usually when the patient, they come to the office and they have the sensitive skin, the sensitivity is possible is because of rosacea, because of the broken capillaries, it's because of the environmental pollution. It's all depend on what kind of sensitivity they have. For example, I have some patients, they come with rosacea. I believe the rosacea is that they are kind of bacteria. What I do, I try to just remove all the dead cells of the skin and use some kind of peel to help to kill the bacteria and soothing the skin. This is the way I work with the people, they have the sensitive skin. It's all depend of their concern, and it's depend of what kind of sensitivity they have. And for sure, I go through all the products for them. Some people, they cannot use vitamin C, but they don't know. They are just using the vitamin C, and that can irritate their skin more. They have to have a good they have to have a consultation with dermatologist person or with their skincare therapist.
Great, thank you so much. So I guess overall, the answer is absolutely. There are a number of treatments someone with sensitive skin can get, and everything is fully customized in the office. One of the benefits of why we have over 60 devices is so that we can tailor them. So someone with very sensitive skin or any other concern, we're going to have something for you. So a couple questions here about Take 10. So Dr. Loyal, maybe you could tell people what Take 10 is, and then people are asking a little bit about what the downtime is and the healing process from it.
Right. So the Take 10 procedure is our proprietary combination of lasers that is going to rejuvenate the skin to the highest level. That's why it's called Take 10, because essentially we could take 10 years off with a single procedure. So this single procedure is, again, curated to an individual patient's specific skin needs. So above and beyond, it's going to involve a fully ablative CO2 laser. And that laser is going to rejuvenate you from sun damage, as well as smooth out lines and wrinkles, even pesky etched lines, particularly around the mouth. Additionally, a benefit of the Take 10 and our CO2 laser is that, unlike surgery, we can improve crepiness of the eyelid area. So what I tell patients is that this procedure, we're smoothing out the skin. It's something that one cannot get with traditional surgery. You could get a facelift and be pulled from here to the moon. in terms of how tight the skin can be pulled. However, the skin quality, the crepiness of the skin, the fine lines, the etched lines, that cannot be addressed with pulling the skin with either a facelift or an eye lift or blepharoplasty. So that's what really is the hallmark of the Take 10, making everything smooth and giving you fresh skin. In addition to the CO2, we combine it with a laser that addresses redness and broken capillaries. Again, that's something that will not be taken care of during a traditional facelift surgery, and a laser for brown spots. Additionally, we tend to customize the combo of lasers, and we might use a different laser for the neck, typically a fractionated CO2 laser, and even a non-ablative laser for the chest to rejuvenate the chest. And some people even will rejuvenate their hands during the procedure. So it's totally customizable. What I tell patients about downtime is that you're going to be my best friend because I'm going to see you often in the office and you're shepherded through the whole process. I would say that you can anticipate seven to 10 days of healing. And it's totally orchestrated. It's not only myself, but it's a team of nurses. So even prior to the procedure, you're having a whole education session with our nurse educator and pre-op nurse. So your hand is held throughout the whole treatment, before, during, and after.
And so during the healing process of, 7 to 10 days, what kind of healing can they expect? They're asking, is it flaking, swelling, browning of the skin? What does it look like?
So the 7 to 10 days of healing is basically your investment of how you're going to look for the next 10 years. So in my opinion, 7 to 10 days is a small fraction of time for you to look like you were just reborn for the next 10 years or longer. So small investment for long-term gains. Yes, there's going to be redness. Yes, there's going to be swelling. Yes, there's going to be flaky skin. We're going to get you through it. And during the consultation, myself and my physician colleagues do not hide this. So we want to show you progression healing photos to set you up for success. No one should go through this procedure without being thoroughly knowledgeable of what you're getting yourself into. So we educate you thoroughly, as does our pre-op nurse, and every patient does well. We're extraordinarily experienced. Probably one of the few, if only, office in the entire country that were combining over $1 million worth of lasers to give this type of procedure. Not many offices have all these technologies and support staff in terms of nursing that knows how to handle this type of treatment.
Absolutely.
Can I say something here?
Yes, please.
Usually, if Dr. Loyal is agree with that, usually what I do in last 20 years when I'm working with the cosmetic team, before the laser, before any kind of laser, like fractal laser, CO2 laser, I highly recommend that the patient to come in our office or any other offices or any places they want to do that kind of laser. Go and have a good exfoliation. Do a good exfoliation, do a good extraction, and throw away all the products you have with mineral oil. Because after the laser treatment, you have to use a lot of oil on your face, a lot of cream, almost like Vaseline on your skin for the healing process. And they can cause the media of your skin. Then usually what I do, I recommended my patient first to do a good exfoliation, extraction 1 week before of your laser treatment. And then few weeks after the laser, for sure, because the skin is a lot of inflammation and the redness, I can do many different things. Usually I do the post-op hydrating treatment, or I can use the jet peel. The jet peel in Europe, we are using it in the hospital for the victim burning, for the third grade burning. because with the pressure of the air, we can send all the peeling products deep to the skin. If we cannot touch the skin, then I can send the products deep to your skin. Usually, I do those treatments for as post-op to help with the healing process faster.
Great. Great. All right. This is a good question that I think both of you can touch on. So, what procedures can help with acne?
So for procedures, my go-to is the Acure Acne Laser. So the Acure Acne Laser is a laser that specifically targets the powerhouse of acne, which is the sebaceous gland. The procedure has no downtime. You'll be minimally pink, and that goes away in a few hours. And we did the initial studies here at Cosmetic Laser Dermatology to get the FDA clearance for the device back in 2022. And that's typically my go-to.
With my treatment, I go with few different things. Definitely with the facial to control all the blackhead, active acne. I do extraction and I use the peel. Definitely customized facial, chemical peels, and usually what I do before the PDT laser or even Acure laser, I do a deep cleaning facial extraction, and I use some kind of peel to control the oil of the skin. The skin is ready for the laser treatment. And then I send the patient to have the laser. PDT laser or Acure or any other laser for the acne. And I have many different kind of peel too. Usually after the laser treatment, few weeks after the laser, because some of the things coming to the surface, they can come and I can take care of that. I don't have.
I really hope that you guys can all spread the word about these acne treatments, because so many people don't realize that there are so many great options now, especially because things like that Acure laser are so new. I think there's only probably a handful of them in the entire country available right now.
And the other things is the salt facial. I'm sure Dr. Laura,
Yes.
you are very agree with that treatment. The salt facial does few different things, and it's not too much of that machine all over in United States. What I do with natural organic sea salt, I do a good exfoliation, which it kills the bacteria suiting the skin. Then I do the peel. After the peel, we use the ultrasound to open the cells and push the products and the peel deep to the skin. And LED light is one of the best for the acne to help to kill the bacteria suiting the skin and producing the collagen.
Yes. You've actually done the salt facial on me a couple times when I've had some active acne, kind of in between getting the treatments at CL Derm. I loved it. All right, so this is an interesting question that might take you guys each a few minutes to talk about. So as far as a rejuvenation plan goes, what do you recommend someone starts with in their kind of like late 20s and early 30s that they can start to do as preventative? So Dr. Laura, why don't you start?
So a nice treatment that would get you started in your rejuvenation plan, in my opinion, is neuromodulators. I think it's probably one of the most satisfying procedures that one can have. It does a variety of things. Of course, we know neuromodulators like Botox to ease wrinkles and lines. Additionally, you will see a skin quality improvement. I talk a lot about skin quality. It's probably my most favorite topic to talk about. And if you have to start anywhere, I think improvement of skin quality, be it fine lines and texture, photo damage from the sun, is the prime place to start at any age. So neuromodulators, and then I would say clean up the sun damage. And that can be done with even a light, no downtime laser or light-based device like IPL or Clear and Brilliant. And if you maintain your skin quality, you will look wonderful at every single decade of life.
I love that. So Farzaneh, what do you think someone should start doing as preventative in their late 20s, early 30s?
100% agree with Dr. Loyal. And in my side, any kind of age, we have to take care of our skin. It started from 13, 14 to go up to 80, 90. And as everybody knows, I have the same patient. It started from 13 years old. I have patient 95 years old. Still they are coming to me. Definitely, we have to take care of the skin from the beginning when we are teenager. As you said, we talked about it. First, the dead cells. The dead cells clog the pores. They become whitehead, blackhead, large pores, active acne, and all the problem started from when we are the teenager. We have to make sure we are using the right products on our skin. For sure, I go with started from 20, please use the vitamin C because the vitamin C produces the collagen, protect the skin from all the diseases, from environmental pollution. This is number one products we want to have it from our skin. The good quality of the products can help with that. And for sure, all different kind of injection, the treatment, the pills we can do, everything can help with the patients. Doesn't matter if we are age 20 or 95.
Right, that's great. All right, let's see. Some people are asking questions for melasma. Are there any, first let's start here. Are there any laser therapies? Can they get laser treatments at CL Derm or are they contraindicated for melasma?
So I see patients every single day with melasma, and melasma can be treated with lasers. So the key is that you have to go to an expert, such as myself and all my physician colleagues, because melasma can be a little tricky. It's finicky and can flare. So I like to use light lasers in a sequence of treatments. We have the name of the game with melasma is low and slow. Lasers with low energy, low density, and going slowly, and you will have improvement. Number two, the hallmark of melasma treatment is protection from the sun, so really good sunscreen, and at-home therapy. Although I would love everyone to be in my office every single day, that's not possible. So boosting what we do in the office at home with really good skincare and maintaining that result with really good skincare and a good regimen at home will make sure that your melasma is under control for as long as it can be.
Dr. Loyal, are you agree sometimes with the VIP for procedure plus we can keep control of melasma a little bit?
I think using both light lasers in addition to chemical peels are a really good option. So sometimes you have to challenge the skin in different ways. So alternating between lasers and chemical peels or starting with one and transitioning to the other, I think can be quite helpful. Because again, the skin needs to be challenged in different ways. And lasers and chemical peels work a little bit differently to improve a tougher condition to treat, such as melasma.
I love that. Okay, just one more quick question for melasma. Any thoughts about at home or in-office red light treatment for melasma?
So at-home devices, I am not a fan of for two reasons. One, if the device is safe to use at home by a person that doesn't need any training for the device, then likely the device is not doing much. The device has to be so safe that anybody in any home across the country can use. So that's number one. Number two, I have seen patients in my office use an at-home red light device and it be too hot or cause more damage. So then you're starting from ground zero again, and we have to then do other remedies in the office to get your skin looking the best it can. So sometimes it could flare the melasma. I've even seen reports, because our annual dermatology conference just concluded this past weekend, and some of my colleagues have even told me about patients they have seen that were burned by an at-home device. So I'm not a fan.
Me either, because I see a lot of patients. Okay, the people, they buy the red light, they are thinking it's going to help them. Believe me, if the red light works, then the office, all the dermatologist's office, the door has to be closed, because that helps with anti-aging, producing the collagen, those kind of things. I believe of the blue light, definitely, it helps to kill the bacteria. It helps with the people, they have the acne. But most of the people, when they buy the red light, if they don't know, if they have, many people, they have melasma, they have the brown spot, as Dr. Loyal said. The people, they sell that device, they never tell them, do not use it if you have the pigment. They have to use it every day, 30 minutes at home. And think about it, that heat is going to cause more pigment on the skin of the patients. Please do not go for that device.
So someone else had asked a question about, is our IPL at the office similar to the at-home IPLs? And I think we basically just answered that question, but real quickly, Dr. Loyal.
So no. So the interesting fact about our office, I don't know if many patients know about this factoid, but the IPL, or intense pulse light, was invented and modernized by the office's founder. So if you were to get an IPL at any office in the country, you would want to go to where it was started, which is Cosmetic Laser Dermatology. There's probably no other group of doctors in the entire world that know more about IPL than here at CLD, which is right here in San Diego.
Yeah, absolutely. All right, so this one is going to probably take you a minute, Dr. Loyal. So I'm glad you're taking it. But I think it's a good one. So we offer so many lasers. This person's saying it's a little confusing. Can you break down what lasers we offer and what each one does? We have over 60 lasers, so I know you can't do all of them, but maybe you could do a highlight for us, and maybe we could do a longer version on Instagram later.
So I think what Risa just said is if you were to get anything what I'm about to say out of it, the number one thing Risa already said, we have 60 different devices, probably the most of any private office in the entire country. What is the benefit to you as the patient from an office and a group of doctors having this many devices? And the number one most important thing is that every single treatment is customized. You come to us and we do not have to fit you into a category. We have every single device in every single category to curate what you need and what is safest for you. Unlike many other offices across the country where you present, they might have a few devices that they need to try to put you into a category to use that device. Here we mix and match on a daily basis. Sometimes I joke with my patients that you're going to get a tour of the office, because we're going to be going from laser to laser to laser in the office. By the end of our session, you've gotten the whole tour. So in terms of what we have in the office, again, light-based devices like the IPL invented at Cosmetic Laser Dermatology. We have our heavy-duty lasers for the Take 10, ablative, going to give you dynamic results, but with downtime, getting rid of those etched wrinkles. We have what I consider a nice medium aggressive laser that minimal downtime, good for photo damage, such as our Fraxel lasers. We have skin tightening devices that are all non-invasive, no downtime. And we have every single one, Thermage, All Therapy, Softwave. We have microneedling, which can be used for scars, acne scars, skin tightening. We have pigment lasers, so lasers for brown spots, lasers for patients with more melanated skin, so that's extraordinarily important. We could treat every single skin type. Lasers for tattoo removal, hair removal, vascular lasers for things that are pink and red and broken capillaries. And then above and beyond, we have our more surgical procedures in our 3 accredited operating rooms where we do liposuction, vein procedures, if our Take 10, and we even can do some of our procedures if with a little bit of medication, if that is your choice, with a whole team of nursing staff that has critical care training. So we basically have every single device in every single category.
Absolutely. Absolutely. Thank you so much, Dr. L'Oreal. I know that was a big question, but I think you were able to answer it. All right. Let's get to a few more questions here before we wrap. So Farzaneh, maybe you can start here. What do you think about the difference between the chemical versus mineral sunscreens in terms of, keeping dark spots at bay and just in terms of how effective they are?
I usually go with the mineral sunscreen because the chemical sunscreen, Dr. L'Oreal, please let me know if I am okay or wrong, right? I don't go with the chemical peel for the people they have the pigment because that can cause a little bit more irritation to the skin. I usually recommend the regular.
Got it.
Okay.
You're back. You're here. So, Dr. L'Oreal, what do you think about chemical versus mineral?
So I like mineral sunscreens, particularly post-procedure. They're usually less reactive with the skin. I also like mineral sunscreens for individuals that have sensitive skin.
Okay, thank you so much. All right. This is an interesting question. I'm actually personally interested in the answer. Is there any treatment that works on both acne and wrinkles?
Ooh, so interesting question. And acne and wrinkles. So everybody is always asking me, is there one treatment that's going to take care of multiple things? And to treat acne and wrinkles, it's somewhat difficult. However, some of our acne treatments stimulate collagen, which is going to improve the improve collagen stimulation, thicken the skin, and make wrinkles less and less. And one treatment for that is our photodynamic therapy combination treatment, where again, we're curating it for you and combining different devices. So we include within that intense pulse light, or IPL, which is not only going to improve your acne, but sun damage, as there's also evidence to stimulate collagen, so for improvement of wrinkles. We include a vascular laser, and then the actual photodynamic therapy part, which is not only going to help with acne, but collagen stimulation, and if you have pre-skin cancers and sun damage. So an individual that is looking for one treatment that could handle both, photodynamic therapy might be a reasonable option.
And with my treatment, I have VIP, which the VIP help with the acne scar, and because it produces the collagen, it helps with the fine lines too. This is one of my treatment. The other treatment can be the jet peel, because I infuse the products for the acne to the skin, plus producing the growth factor, hyaluronic acid, everything to the skin to help to minimize and smooth out the fine lines. And one thing usually always I ask when I have a patient, they come with the acne, and they want to take care of acne scar, I always tell them, please first treat your acne and then think about the acne scar. Always, it has to be that way, because if you have acne and we do laser and treat the acne scar or any kind of peel, again, the acne comes back and it doesn't mean any sense. That's why I always recommend it. Treat your acne first and then think about the acne scar.
Absolutely. Okay, great. All right. This is a fun question. Can you do the fractional laser anywhere on your body? Can I do my whole body if I can afford it?
So a fractionated laser akin to our Fraxel laser can be used safely on any part of the body. And it could be used for sun damage on any part of the body, as well as for the collagen stimulation 1550 version of the Fraxel can be done almost on any part of the body. We typically treat face, neck, chest, hands, arms, I guess if you're very motivated, legs, and we curate the settings to make it safe and effective. The bigger the surface area, the longer the treatment it will take. But face, neck, chest, hands, arms, I would say are the shoulders, most popular.
Yeah. All right. This is a good one because it will get us into our scar discussion. So are there any procedures that we have to treat scars? And this person's specifically asking about keloid scars that were caused after a skin cancer excision.
So we use a variety of lasers. So when I talk to a patient about scars, I talk about one, color. So the color of the scar is important. We want to optimize that. If it's pink, red, purple, we want to address that to make it more skin tone. Two is the architecture of the scar. So is it raised? Is it divoted? That's all important things that we will use, not only lasers, but what we call laser-assisted drug delivery, where we're using a laser to basically allow some medications to go deeper into the skin. And then we want to blend the scar in with the surrounding non-scarred areas. So we treat keloid scars on a daily basis. And a few sessions, we can make it look much better.
Yeah, absolutely. And scars are very difficult to treat. I will tell you guys, we have people coming in from all over the country and even over the world to treat scars because it takes such expertise, like what Dr. Loyal was just saying.
Dr. Loyal, what do you think about microneedling for a scar?
So I have used microneedling for different scars in different locations. I think it could be a reasonable option when for certain patients that maybe we have a concern of hyperpigmentation. There's a lower risk of hyperpigmentation with radiofrequency microneedling. I have used it successfully in both keloidal scars as well as your run-of-the-mill surgical and or acne scarring.
Yeah. Thanks for bringing that up. So, okay, sounds like some people are excited about injectables, but they're asking, is there a certain percentage of people that have a bad reaction to injectables? Is that something they should be concerned about?
Exceedingly rare. Exceedingly rare. So the majority of our fillers we're using are hyaluronic acid based, and hyaluronic acid is a natural substance that's in our bodies already. It's in our eyes, our joints, our skin. So that's one. Two, all of us at Cosmetic Laser Dermatology are going to be asking you specific medical questions to make sure that this is a safe procedure for you. And that might be even asking you questions, when have you had a vaccination or dental procedure? And we'll then schedule your dermal filler procedure around that.
All right, let's see a few more questions I think we can get to. So this is an interesting one. Dr. Loyal, is there a recommended procedure for cellulite on the stomach? And if so, what kind of results are realistic to expect?
So cellulite on the stomach, or it could be stretch marks on the stomach, probably stretch marks on the stomach. And there's a variety of treatments for that. One is we want to build collagen. So something as simple as Sculptra can be very beneficial. Two, we like to think of, again, collagen stimulation with lasers, such as our Fraxel Restore laser. And then three, skin tightening procedures such as Ultherapy or Softwave, all could be used in combination or as a series of different treatments. And then at-home care. And what does at-home care look like? Maybe something like a firming cream, like a retinol. And one of the newer favorites of the office, Skin Medica's Firm and Tone. Another factoid of the office is Skin Medica was also invented at Cosmetic Laser Dermatology.
I love that birth story. If anyone wants to check it out, I'll pop a link into the chat in a minute. But thank you for answering that. That is interesting. All right. A few more questions. So what are the benefits of RF microneedling on the face?
The benefits are multifactorial. So one is you're going to get collagen stimulation in two mechanistic ways. One is from the microneedles itself, so the microtrauma from the microneedling. Two, from the energy from the radio frequency. So you're going to get a more robust collagen stimulation procedure with radio frequency microneedling. So that's one. Two, you're going to have improvement of fine lines, wrinkles, skin texture. There's even more evidence, and we learned this at our meeting this past weekend, that there's even improvement in pigmentation. It could even be used for melasma, and we could use those microneedle channels to then deliver some medications to further amplify your procedure.
Oh, that's great. All right, so a couple people were interested in your feedback about crepey skin and how to treat it, and they're curious about costs. I know this is hard to answer, but what can you tell them since a lot of people are interested?
So one is crepey skin is treatable. It does take effort. So that's just the nature of the beast when dealing with crepey skin. It takes a little bit of effort. And where on the body are we treating? That is definitely a consideration. The body surface area, such as, let's say, the arms, very common area. Some individuals are just bothered by the inner arm crepiness. Others want, maximal benefit. So we have a variety of treatments at different price points. Sculptra is an injectable that's quick and easy to do. Others are more involved, like Ultherapy. So one of the key things in the consultation is we want to know what your expectations are, what is your budget, and we'll curate a plan for you.
And one thing I can do for the crepiness is the peel I'm doing, because I have a lot of different peel. What it does, it helps to produce the collagen. That's why it helps to bring the elasticity of the skin back. I do 1 or 2 treatments. If they are happy, it's great. If they see a good result, but they want to see the better result, then they can do the laser. Because when we remove layers of the dead cells with the peels, because the peel work on the surface and the lasers work from the deeper layer of the skin, we attack the skin from both sides. This way they can have the better result. I have many patients, they do that treatment.
Okay. Dr. Loyal, I've been doing Botox or Dysport since my 20s as preventative maintenance every 6 months. So yay for that person. I will be 40 this year. Do I need to start getting Botox at a greater frequency now that I'm older? And at what age is the addition of filler typically recommended?
Right. So everyone is an individual when it comes to how long their Botox or neuromodulator is going to last. I'm not 40 yet, but for me, it only lasts about 3 months. And I feel like the 3 to 4 month time frame is a nice check-in in the office. So I like to keep my patients, educated on the newer treatments, check in how their skin is doing. And I feel like that 3 to 4 month window is a really key time frame because the seasons might be changing. They might look like they're stable in San Diego, but there's little nuances, maybe a little bit more humidity, a little bit of this, which has effects on the skin. So it's a nice cue in to check in on the skin. But if it's lasting every 6 months, that's great for you. I wish it lasted that long for me. And then in terms of dermal fillers, I think everyone is a individual. I treat patients as young as in their 20s with dermal filler. And again, it's not just to volumize, it's also to balance and to contour the face. And I recently posted on my Instagram about how I had dermal filler this past Friday when during our American Academy of Dermatology meeting, my best friend was in town and I had my face injected. And just to squash myths about dermal filler, so I had about 5 syringes of filler placed in my face, and I look natural, like nothing was done. And I think that's the key, is that you want to continue looking like yourself. That's the goal. We want it natural. And going to somebody that's an artist, like all of the physicians at CLD, will keep you looking natural, just a better version of yourself. You should not be morphing into somebody else. And I think I still look the same, only less tired and more rejuvenated. And I went to a gala right after the dermal filler. Risa was there.
I
No
know.
question.
I saw on your Instagram that you had done that right before, and you guys can see the gala photos also on our Instagram. I'm trying to grab the link right now. I couldn't even tell you had been treated. That was amazing.
So that's the goal. The other goal, I think, is small improvements have a drastic impact. So to me, I was looking a little tired, and these very nuanced changes with a little bit of filler made such an impact for me.
For sure. All right. So let's see. Before we wrap up here, Farzaneh, do you have any final kind of words or anything to share with everyone before we close down here?
It's just the consistency with the products they are using and the treatment they do it in the office and with the skin, with the lasers, Botox, peels, extraction, everything. I believe the key is the consistency.
Consistency.
Thank you. Yeah, that's the.
I think that's a really good point. And that's kind of like what Dr. Loyal just said. If you kind of think about coming in every 3 months to see us, whether it's for a treatment, a check-in, whatever it is, I think in an ideal world, that would be your recommendation,
the
right?
products they are using at home, it has to be. Please do not give up from the products you are using. Sometimes the people they are thinking after 8 weeks, 6 weeks, they are using the products. If it doesn't work for them, they throw it away and they go from the other products. Just keep using it. Some products, it takes 3 months to see the best result of that. Just keep using until your skin gets used to it.
Good advice. Okay. And Dr. Loyal, how about you?
Continuity. So I think that's a real key for rejuvenation. Continuity. The face should match the neck, should match the chest, should match the hands.
Absolutely, because that is always the telltale sign something's off. I love that. So I have posted Farzaneh's, Dr. Loyal's, and CL Derm's Instagram link in the chat here. So I would love for you guys to all go there and follow us so you can keep up and so you can see that treatment Dr. Loyal was just talking about. I'm sorry, there were a couple questions left we couldn't get to, but if you follow us on Instagram, you can ask them as a DM and we can try to get to as many as possible because we really want to educate as much as possible. But overall, thank you so much, Farzaneh and Dr. Loyal, for spending some time with us. I know you've both had a busy day seeing patients, but I really appreciate it. People are saying that was very helpful, very educational. So thank you so much for your time. Thank you to everyone that tuned in. We appreciate you spending some time with us and, wanting to learn and just do it the right way. And we really hope that we can see you for a consultation in the office because everything we do is so customized. So scheduling a consultation with Farzaneh, Dr. Loyal, or anyone at our office is a great next step. And even though our phones are now closed because at 6:30, you can book online on our website to do a consultation with either of them at your convenience. So I really hope we see you all soon. And thank you so much again, Dr. Loyal and Farz.
And thank you, everyone. And thank you, Lisa, again, for everything you do for us. Thank you. Thank you, Dr. Loyal.
Bye-bye.
Bye.
Bye,
Bye.
everybody.